Health. Welcome to our Women's Health event. Today we are actually joined by Kimberly Lightborn. She is actually going to be talking to us about Oriental medicine and acupuncture. She has a master's degree in Oriental medicine and acupuncture. So Kimberly, how are you doing this evening?
Alhamdulillah, I'm doing well.
Oh, great. So let's get started. We have about an hour, and I know this is a really interesting topic and that we're all excited to learn more about it.
Yes, let's go ahead. Just to, just to give you a bit of information about me, my background is acupuncture and Oriental medicine. I graduated from the college here, Florida College of Integrative Medicine in 2008. And I'm not practicing as of yet. I ended up after graduation, while I was in school, I had my first daughter. And then after I graduated, I had 2 more children. So that's been preoccupying me for now. So, but Sadaf had asked me, we were talking and I mentioned to her, though, I have a degree in that. And she was like, oh, that would be great. We can talk, have that as a talk for our women's health. And so here I am. Ready to explain some basic information about acupuncture and Oriental medicine. I'll try to keep it as simple. I didn't want to go into too much depth so it wouldn't get too overwhelming. But if you have questions, we can definitely go to those questions after we go through everything. All right, so the big question is, what is acupuncture and Oriental medicine? So acupuncture is basically, it is a form of primary health care. And that's indicated in the Florida Board of Acupuncture and Florida Board of Medicine. Acupuncture is based on traditional Chinese medicine and modern Oriental medicine techniques. So traditional Chinese medicine encompasses, I'll tell you what that encompasses. It encompasses herbs, massage, and other modalities that I'll get into in a few more slides. But acupuncture in general, its purpose is to maintain the overall body balance in the body by restoring it to its natural health and to prevent disease. So when we are sick, our bodies are obviously out of balance. So when you're seeking an acupuncturist, we're going to work on putting your body back in balance. So the way this is done by recognizing a pattern of symptoms in the patient. So whatever symptoms we're seeing, we diagnose the disease, and then finally we compile a treatment plan that utilizes acupuncture points and traditional Chinese herbal formulas just to bring the body back. And so as we know, when we do get sick, sometimes it's acute. It can be something really quick, like a common cold, which wouldn't take too long for your body to get back in balance. But it could be a disease that's been going on for a long time, where it might have taken years for you to get to that point. At that point, it's going to take maybe months, almost a year for you to get back in balance with acupuncture and herbs. So in order to understand acupuncture and herbs, you really need to have a good understanding or some sort of basic understanding of what is qi and what is yin and yang. So qi is your life, in simple terms, it's your life force or a moving power throughout your body. More easily, we would say energy, but it's a little bit more than energy. Qi can be physical and it could be mental, spiritual. So if qi isn't moving in the body properly, we would call that stagnated, and you might feel that by some sort of pain in a local area. If it's mental, spiritual, you might have maybe a mental disorder, or you just might, something else is going on where mentally you're not in balance. Qi in itself is the root of the human being. So without qi, there isn't the human being, and qi is not without the human being. So they're one and together. Yin and yang, that theory is everything has 2 opposing qualities. If you ever looked at the yin yang symbol, you would see that it's a black and white symbol, and each part of it has the opposite color in it. So The yin yang is the struggle, the basic struggle to maintain balance in the body by controlling each other, by controlling each side. So the yang side, which is heat and it's light, that would represent the white. On this symbol, if you look at the next screen, it would represent the white. There will be a black circle in there, a black dot, that represents yin, which is cold, so it has that balance. And then the yin, which is cold, will have the dark spot. So those two have to maintain in balance for your body to work properly. So as you can see, everything in nature is a cyclical. You look at the cycle of the moon, the sun, everything goes through a phase, and that is yin yang. It is a balance and it goes through a phase. One cannot be without the other. Now with the qi, if you look at the qi symbol, that symbol literally means in the middle where you see like the line and like the lines going out of it in the middle, that is rice, uncooked rice. And the symbol, the rest of it on the sides, the lines going down and out and on top, that represents steam or vapor. So qi in itself, that symbol is used as you have something solid, and when it's contained in something that has steam or vapor, it evaporates out. So qi can be solid in one form and vaporized and rising out in another form. Okay, let's go to the therapies that we use as acupuncturists. So one, very simple, we use needles. You can use acupressure, which is just pressing your thumb or your finger on the acupuncture point for a prolonged period of time. That can work. Or we have little like Band-Aids with magnets on them that you can put on the acupuncture point, and you can use that for a prolonged period of time. That's acupressure, but we primarily use acupuncture needles, and they come in a variety of sizes, and I can show you some at the end of the presentation. We also do cupping, which is known as hijama. We use, our cups are glass cups. You have, traditionally they were bamboo, big bamboo cups, but now we use glass cupping or suction cupping. Moxibustion is an herb that is burned on the body to help promote healing. In addition to the acupuncture, it can be placed on a needle, or it can actually be placed in like a burning cone or cup directly on the body, like with a layer of cloth beneath it. So the body isn't burned and the smoke dissipates into the body. And that way it promotes healing. It enters the channels that way. We have Qigong. Qigong, in simple terms, is the long-term study on how to deal or handle with Qi in your body. Some people consider it a martial art, but most Qigong practitioners don't like to box it in that simple term. It is just basically how you study the Qi, how you learn how to study the Qi in your body and how to deal with it, how to manipulate it through certain movements. You have Tuina, which is the Chinese massage. And this is basically rubbing and pulling on the body. So you can rub in one direction or you may pull in another to release stagnant blood and increase circulation. So when any of us actually go to a massage therapist, we always leave feeling really good because they're rubbing your body, they're moving the blood and they're circulating throughout the body. Tuina goes a little bit more deeper than that. We're not just we're rubbing and pulling on the body. We're also working with the tendons and ligaments, pulling and making sure that they are loose, and so that you can feel the circulation in your body.
The Zoom meeting, MW.
We also use herbal medicine, and this is considered traditional Chinese herbal medicine. So those are herbs that we combine together in a formula so that you can use it in conjunction with the acupuncture to promote the healing of your body. Because technically when you're getting acupuncture, you're getting it maybe twice a week in the beginning, and then it tapers off to once a week. So therefore the herbs help to, the acupuncture actually helps and opens up the channels in the body so the herbs can work on the inside the body to promote healing. We also use dietary therapy, which is food therapy. We prescribe maybe a food therapy plan, a diet plan that you can follow if you're eating certain foods that are causing your ailments. We obviously would tell you to avoid those, but eat certain other foods to promote healing in the body. And we may assign it for like a week or two. And then when you come back, we can see what kind of progress you've made. And all of these therapies can be used together to promote healing. Now, electroacupuncture therapy, that we just simply call it e-stim, is when you have an e-stimulation machine and you have the nodes and the clamps. Sometimes you see this in a hospital when they're doing heart monitoring or anything like that. But we have the clamps where we'll put it at the end of the needle, and the needle's already inserted in the body. And primarily we're using it for constant manipulation of the needle while it's in you to promote more healing in the body. Okay, so that's just a basic introduction as to what is acupuncture. Now, some people don't know how our acupuncture is educated and certified, so I'll just go into that right now. So in order to practice acupuncture, especially in the United States, it is a master's degree program. You have to go to find an accredited program, and it's usually a 3 to 4 year program. Here in Orlando, the program I went to was 3 years. There are about, I think, 2 other schools in Orlando. There's one not in Orlando, in Florida. There's one in Sarasota, and there's another in Gainesville that teach acupuncture. There are doctoral degrees. Those are 2 year programs. One is in Texas. I know there are about 7. I know of 2 there. One is in Texas and the other is in Oregon. And they specialize in certain areas. I know the one in Oregon, I looked it up before. That school specializes for your doctoral degree, specializes in gynecology and geriatrics. So that will be your area of concentration if you decide to go through that program. Certification is through the National Certification Commission for Acupuncture and Oriental Medicine. They're based in Washington, D.C. This is the certifying board for all acupuncturists in the US, even California. California actually has their own separate certification board. So everywhere else, probably except California, this is the board that certifies you for acupuncture. So you have to go through them as a requirement for licensure. So you have to be licensed to practice, and you need to have insurance. Just like medical doctors, you need to have insurance to practice as well. So once you are ready to take your boards, obviously you have to graduate from an accredited program, a 3 to 4 year program, and satisfy the completed hours of instruction. We also have to take a course called Clean Needle Technique. This course is just certifying us in that we are using correct technique in the treatment room and on the patient. Like, we know how to insert the needle properly. We know how to, we have certain supplies we need to have out when treating the patient, whether it's alcohol, cotton swabs, anything like that. We need to have those out. We need to understand what each thing is for. And we just have to demonstrate that. It's not a difficult course, but it is one that's needed before you can even begin to apply for certification. So once the acupuncturist does apply for their boards, just like anyone else, you take your test. And if you pass, when you take the test, you have to pass the following subject areas. Now, this is where each state differs. Florida requires that we take foundations of Oriental medicine, which is theory. So we have to clearly understand theory. acupuncture and point location. So we have to know where all the points are on the body, and we have to know how to diagnose the patient. So the test will give you a sample treatment plan. Say like you have a patient and they will list all of the points, and they will say, now which is the diagnosis for that? So we would have to do that. And Acupuncture Practice Act, that is kind of like the doctor's Hippocratic Oath. That's just, some states require it. Florida doesn't require it, not for testing. It's just something that you have to know. And the areas that are optional in some states are biomedicine. Some states do not require any type of Western medicine knowledge. The school that I went to here, it does require it. We have biomedicine, we have radiology, anatomy and physiology. So we have to take all of those courses. In herbology, some schools don't require it. Florida does require herbs. So we would have to take foundations of Oriental medicine, acupuncture and point location, herbology, and biomedicine. So that's 4 exams that we would have to take here in Florida to pass to be licensed as an acupuncturist. Now with that, once you are certified, you have a couple options on your title. Some acupuncturists will answer to doctor, because that, you know, that's just what people are used to saying. But some will have the patients call them by the first name. But title-wise, when we're writing down our title, after our name, we can either have AP for acupuncture physician, LAC for licensed acupuncturist, diplomat of Oriental medicine, or diplomat of acupuncture. Okay, so in addition to acupuncture, falls in the category of alternative medicine. For some people, just to understand it better, because it's not technically the mainstream medicine that we have here. So you can use the terms interchangeably as alternative medicine or integrative medicine. Now, these are basically holistic treatments in lieu of traditional medical therapies. So acupuncture is right at the top, it's right there. Then you have Ayurveda medicine, which is the holistic whole body healing system practice in India, which encompasses what we all know as meditation, yoga, diet, and massage. Homeopathy, which currently is not practiced here in Florida. The schools, I remember when the schools did shut down. So anyone who graduated from a homeopathy school before they closed can still practice, but anyone who gets their degrees somewhere else and tries to move to Florida to practice, they cannot. But homeopathy uses like a like for like cure. So if your symptoms are this one thing, then they're going to try to cure you with the same thing, or the law of minimum dose, which is they'll give you the very minimum dose to relieve your symptoms on a continuous basis to cure you. We have massage therapy, which we know you need to be licensed. Essential oils is something that you don't need a license for that. Anyone can sell essential oils. And pretty much you can sell essential oils, which is just basically the distillation of the oil from the plant, whether it's the flower, the root, the leaves, distilling it in a liquid form, steam vapor in a liquid form. Meditation, that's also integrative medicine. Botanical medicines, herbal supplements, which there are plenty of in the stores, or you may go to another outside store where they specifically carry certain supplements from other countries that you may want to use. Naturopathy, that practice, you can practice here in Florida. They do have a program here, and you have to graduate from an accredited program and also pass the naturopathic license examination board. And so they can practice just like acupuncturists. They're considered physicians. And the Florida Board of Medicine basically says only physicians, licensed in Florida can include or offer alternative medicine to their patients. So MDs, if they've taken integrative medicine courses, if they have another degree in it, they can practice alternative medicine. Acupuncturists are licensed to practice, and naturopathics. So outside of that, I would be careful where you might be getting your information from, or where you're going for a practice. You can always check the Florida Board of Acupuncture to see if someone license is updated, if they're suspended, active, inactive, just like regular medical doctors. All the information is kept updated. Okay, so treatment of common diseases in acupuncture. This is where I try to somewhat simplify it. It goes into a lot more depth than this, but these were the factors that I could pull out that maybe perhaps you can understand. And it's not overly difficult, but I know when I was in school, if you didn't grasp the initial concept of qi and yin and yang, by the time you started getting to this aspect, if you didn't grasp it, there was a good chance that you probably would withdraw yourself from the school. That happened to a couple of my classmates. And then it's common because it's not, you have to change your thinking a little bit to understand acupuncture. But we're going to go ahead and start with identifying patterns of diagnosis. Okay, so with acupuncture, when we identify a pattern, it's based on a few things. It's mainly based on the organ pattern. So you see all these letters I have here. So the first one would be, you have an internal organ paired with an external organ, and meaning like a yin and yang and yin organ. So you have heart, you have the heart, which is paired with the small intestine, and it usually has to do with how the channel runs, the meridian runs through the body. You have the pericardium. The pericardium encompasses the heart. And then we have the Sanjiao or triple burner. That is another, not an organ system that you would know, but it's in acupuncture, it's an organ system. You have the lung is paired with the large intestine. The spleen is with the stomach, and those two are right by each other. Sometimes they're right by each other, sometimes they're not, but the spleen and stomach obviously are right here, so they work hand in hand. The liver and the gallbladder, again, they work hand in hand, and then you have your kidney and your urinary bladder that work hand in hand. Those organs are paired. We also use the 5 elements in the earth, which would be wood. Wood is liver and gallbladder. The fire is the heart and small intestine. And with these elements, you would see these elements appear more readily in symptoms, in how the patient may look, act, color of their skin. So earth would be spleen and stomach. The metal would be lung and large intestine, and water is kidney and urinary bladder. After that, you have pathogenic factors. Now, these are environmental, which could be internal and external. So when you think about it, you have wind. You can think about external wind, wind outside, air conditions, ceiling fans. Cold, wind can become cold. Heat, external heat, internal heat. Dampness, which is kind of tricky, but dampness could be being around a lot of water, or generally dampness is internal when you're eating, say, a lot of dairy, or pretty much a lot of dairy or sugary foods that just create a lot of mucus in your body. Dryness, which comes from heat or fire. It's when heat gets to a point where it's drying the fluids out of the body. And then fire is just the extreme form of heat. Then we have observation. So when you're sitting in front of the acupuncturist, they're going to be looking at you, and they're going to be observing. One of the first things we look at is your tongue. We want to look at the coat of the tongue. Is it white? Is it no coat? Do you have cracks? Is it peeling? Is it scalloped on the ends? Is there any dark spots on it? Does it quiver? So we're looking at all of that when we ask for you to, stick out your tongue to us. Pulse, we're checking the pulse. We have to learn how to identify the different types of pulse. And they range from taut, wiry, stringy, and those are all, you would think wiry and stringy are the same, but sometimes there's a minute difference. Rolling, the pulse can be strong, indicating a lot of heat, or it can be really weak, indicating like a blood deficiency, like anemia or anything like that. We look at your general overall body appearance. How are you walking? What is your behavior? Are you making any sudden movements, any odd movements? Everything, we're observing everything. Like I said, like the color, and that will go back to the 5 elements where, let's say, for example, the color of the earth is green. For spleen, it's green. So we would see if there's like a green color tinge in your skin, then we would know that, okay, there's something going on with this spleen, okay? That's pretty overall simplification of how we identify patterns. There are a few more things in there that I didn't go into. We look into whether the patterns represent yin and yang, or like kidney yin, if it's deficient, if it's full, or if it's empty. So those are other things that ways we have to diagnose what's going on with the body, and that gives a more full picture. Okay, so acupuncture points. Each organ has a channel. So before we went to the organs, and let's say heart, small intestine, or spleen, stomach. Each one of those organs has a channel of points going through the entire body. And those are the points that we use to access your body for treatment. We're accessing the chi in your body through those points. So in addition to those 12 organs or channels that we're working with, we have additional extra points. And those are anywhere in the body. Those extra points, we have them between the fingers, between the toes, they're on the face. Right here, this point is a very common one for calming and sinusitis. They're all over the body. Okay, and then we have points that are in the front, solely in the front, down the middle of the body. Those are called our Ren points, which are for women. These points affect the genitals, the abdomen, the throat, and then they go up to the face. So the Ren vessel starts at the bottom of the lip here and goes straight down to the top of the uterus. And any gynecological disorder, you have to use those points from like the navel down to the uterus, in addition to other points around the same area. Now, we also have dew points, which are the back. So the Ren points go from the lip down to the uterus. The dew points go from the middle of the area of the perineum up through the back to the top of the head. And that vessel, again, those affect the genitals. It helps for back pain, head, and brain. We usually use them mostly for the head and the brain. Okay, we also do ear acupuncture. So there's a whole another set of points that are on your ears that we can utilize. And those are, you have some practitioners that utilize a lot of ear points. We were trained in that in school as well, and we can also get additional training. The top of the ear apex at the very top, that's a common point that we would prick with a lancet to release blood for patients that came in with high blood pressure. And as soon as we pricked it, it would release. We would just massage it and get all of the blood out. And you can tell the ears are really red. And once we prick it and start massaging it out to get the blood out, we massage it until all the blood comes out, and then their blood pressure goes down. But ear acupuncture points, a lot of people use it for drug therapy, like smoking, I wouldn't say drug, but stop smoking, that's a very common one. NADA protocols to use ear acupuncture for stop smoking, and it does work. We used it in school. We had a couple of classmates who were smokers, and just to test it out immediately, we used the techniques, and they basically tried to smoke a cigarette, and they basically said it tasted like metal or something in their mouth, which if you go back to the 5 elements, as far as identifying patterns, the lung is associated with metal. So when that point was accessed on the ear, which would be the lung position, the ear is an inverted fetus. So the bottom of the ear is like the head, the spine of the ear is the back, and then you have all of the limbs going in and around. So once you access those points to stop smoking, like I said, they said it tasted like metal. They didn't want a cigarette then. Now, obviously, you would have to keep doing it until they lost that sensation for smoking. But those ear points work very well for that type of treatment. And we also have a lot of points on the face. You have some students who wanted to do facial acupuncture, which was just like facelifts. And there were points that certain points they would just only utilize on the face and the neck for natural facelift, and it actually works. So you have each organ channel has a certain number of points. So the channel with the least amount of points is the heart, which has 9, and then the bladder, urinary bladder, has 67. So, and that go from the top, from the head, areas on the head, all the way down to your feet for the urinary bladder. That's a very long channel. It goes along the back, and the back of the legs. The gallbladder is another one, the gallbladder channel, which runs along the side. So it kind of follows urinary bladder, runs on the side, and that has 45 points. Now, in acupuncture, you would think that we would just pick a point and put a needle in and hope for the best. It doesn't work like this. Actually, quite strategic when we are selecting points to work with. So, acupuncture, if you want to put the slide, we have, I have a arm. We have main points called shoe points. Shoe points is where we access the chi. So remember, the chi is it's all throughout the body, but there are certain points we have to use to access the chi so that we can get it to start running through the body properly. So the chi, the shoe points, they run like a river through the body. So it starts off small and becomes big. All right, so you have the well points. It goes well, spring, stream, river, and sea. And if you actually think about it, it makes sense, because when you have a well, if you think of anywhere, if you've ever been around a well, it's one concentrated area of water, and you either have to get a bucket where you have to hand crank it like the old days to get the water out, or you have to hand crank where the pipe is in the ground, and you're only getting as much as you put in to get the water. So you're accessing the small area of water. So that's where the chi starts at. And the chi in that area, since it's so contained, it's easily able to manipulate and get out. So a well point would be a point, say, at the top of your finger, or at the toe, like your small toe. So at those points, we use smaller needles, and I'll show you guys. I have some needles to show you and some herbs to show you. Then after that, once you get to the well point, the next point would be, say, the spring, where it gets larger. So you've accessed the well point. Now you're going to a spring point where, okay, now it's widening. Now you can access a little bit more chi. You can get it to flow out a little more. Once you go from the spring, now it's a stream. When you see a stream, what happens? The water's flowing and it's flowing easily. Once you get to the stream, it gets bigger, it goes to a river, it affects more, it spreads out more. And once you get past the river, it's the sea. So now once you're in the sea, now you can have, now that chi can go everywhere where it needs to go, and it spreads out. So the points, the shu points are between, they're between the fingers. For the hand points, they're between the fingers and the elbow. That's just the way you would access it. Then if you hit a C point around the elbow, then it's going to spread out, okay? Then, and the same thing with the foot. It's from the toes to the knee, and then it spreads out. So there are some very strong points in these areas that we use all the time to help affect the body. So that's, you really wouldn't do a formula without those points. You can, and we can talk about it. Those will be called, like, you have ashi points where we localize, like say there's a localized area of pain, what we would call chi stagnation, where the chi is just, you touch it and it's real painful. You can just put needles in those areas and you can still manipulate a little bit. But when you're looking for more long-term results, you're going to have to access some of these shu points, okay? And if you can see on the diagram, you can see the hand where the hand opens up to the elbow, and that's how the river, it starts with the well and then it spreads out. Now the next slide, this is just an example of what the acupuncture meridians look like on the back and the whole body. So I couldn't really find a good close-up, an enlarged picture, I would say, of the whole body. But if you look, like I mentioned, the heart and the small intestine, if you look at the picture, the small intestine channel goes at the top of the armpit there, and then it goes on. If you see that small intestine 9, 10, 11, and 12. So that means that if that's 9, it started here and followed along, and the first point starts here on the pinky. And this zigzag pattern on the back, this is good for shoulder pain, scapula, any pain in the armpit and in that area, back pain. And some of these also help because it's going up to the neck. They also help some of the facial points. So the small intestine channel actually goes up to the face. You also see the urinary, that orange color, that's the urinary bladder, which is the channel that says the largest, has 67 points. And double rows, so it's pretty big. We use this a lot for back pain, and then accessing certain organ channels on that point. And that the middle point, the yellow, that's our due governing point, the one that I said that we use mostly for brain and head acupuncture. That's the one you see it runs right down the middle of the spine. Okay, and then if you look at the next picture right next to it, it shows like how the meridians run through the body, front and back. And acupuncture points are symmetrical with the exception of the ren and du and the extra points, but what you could do on one side of the body, you can do on the other side. So say for instance, you have a broken leg and you have a cast on one leg. Obviously, we couldn't needle that area, so we would needle the other leg. We had situations where we had patients come in with phantom limb syndrome, where they had an amputee, that leg was amputated, but they could still feel like the leg was there, and the nerve endings, it was a lot of pain because the nerve endings were still there and they still felt like they were firing impulses to the leg. So we could use acupuncture to kind of trick it, to make it think that it wasn't there, to ease the pain, because it's not something that, if you ever spoke with someone who's an amputee, it's not the most comfortable thing to be in. All right. So Common diseases. Acupuncture, we always had a running joke. Acupuncture's been around for thousands of years, but we've only mastered back pain and sciatica. So most people will go to acupuncturist for back pain. That's the first thing they say, oh, my back hurts. And yes, I did a lot of back treatments, but we also do a lot of everything, pretty much anything. I did, when I was in school, I did a lot of athletic injuries, maybe overstraining of the wrist. I did maybe some gynecological, common cold. I didn't have too many. I had classmates that had like a lot of sinusitis, allergy treatments that they had to do. I didn't have too many of those, but I had like everything else. We also work gynecology. It works very well for gynecology, whether regulating your menses, infertility. A lot of people take acupuncture for infertility, postpartum, lactation. Those are some of the common areas, but anything to do with your menses, you can definitely almost pretty much get acupuncture for. We have cancer patients that come in, people who don't want, either they don't want to go through chemo radiation, or they want to use acupuncture along with it. And it works great because you can relieve a lot of the symptoms, the nausea, the ill feelings you get with the radiation or chemo. Okay, so let me see, I had some things set aside. So like this I'll just pick out like irregular menses. For us, that is when the cycle is delayed by like 7 days or more. So your symptoms would be like, if you're looking at the tongue, it could be a thick coat, purple, red in color. So like the blood it's stagnated. It's not moved. For some reason, the blood is not moving out of the uterus like it should for menses to come on. So it's something stopping it. Each diagnosis may have, or each disorder may have, like irregular menses can have one or two different diagnoses. Sometimes there are up to 6 different reasons why this person is having these symptoms. And it's up to us through observation and all our other forms of questioning and asking the patient what's going on to determine the treatment plan. So like for irregular menses, once the period does come on, you get blood clots. There might be some abdominal pain, distension in the chest. You might be real irritated, poor appetite, anything like that. We could look at the tongue. It would be a thin white coat, white yellow coat on the tongue. You might have some, if it's blood stagnation, you might have some like purple dots or purple color, and your pulse will be wiry, like it's like real taut and just thin like a wire. A treatment like that you can use, say, and I'll just give an example. It would be soothing the liver, because the liver stores the blood, and regulating the chi, because the chi has been stuck in that area. And now we're trying to regulate it back to a regular flow so that your menstrual cycle can flow on a normal basis. Okay. And so and then we would prescribe a herbal formula, and we would do our treatment of points. And so any issue that a woman would have with her menses, any type of irregular period or even lactation, we usually try to follow the cycle. So if you're coming in with an irregular cycle, your treatment, we're going to follow your cycle for at least 3 months. We have to make sure it's regulated. After 3 months, then we might go like another month or 2 to see what happens, to make sure that it stays on track. So like I said, treatments, acupuncture treatments, unless it's something really simple, like a simple cold, it takes time. And when a woman usually has a regular menses, we've pretty much known about it all our lives. We've just dealt with it. So if you're going to see an acupuncturist, then you can expect to be there for 3 or more months. for anything. That's about average, unless it's something really acute. Let's see, lactation. I had a lack of lactation when I was in school. I went back to school just like a month or two after I had my daughter because I wanted to finish. I didn't want to break that cycle I was in for school. And basically I'm anemic, so that didn't help. And then on top of that, you have school. So my lactation, my breast milk was I won't say thinning out, but it was not adequate enough to continue to breastfeed. So I think I lasted like 6 months, and that was with herbs. And at the end of it, my doctor at the school, she's like, it's just, you're in school, you're stressed. It's not going to work. Something has to be eliminated. And so what that does is that shows you how important it is for us to take care of our bodies. We put a lot of stress on ourselves, and something has to give. So unfortunately, I had to stop breastfeeding, and I continued school. But it was a lesson learned, because when I had my other children outside of school, I was able to breastfeed for 2.5 years, no problems at all. I was still anemic, but I didn't have the extra stress that was blocking the chi and the blood for my body to produce the milk. And so you can get lack of lactation treated. However, you have to look at some of the external factors, okay? Common cold, like I said, that would be an invasion of wind in the body, and that can be anywhere from you're sitting in a really cold environment, you're indoors and the AC's blowing on you, or you could be outdoors and there's a lot of wind, it's cold weather, and that wind is just hitting you. And the skin on the neck, and then you have the orifices on the face, the nose, and the mouth. That's where the wind is going to come in the ears. So you could get an ear infection, you get the runny nose, all of the regular symptoms for cold and flu. And those are somewhat easily treated. The problem comes in when the cold stays in the body and it becomes heat, and then you get more of a more flu symptoms. You get the purulent runny nose where it's not clear. That's when you know it's either cold or heat. Because if it's still cold, it's clear and runny. But when it turns to heat, it comes yellow and more thick, because it's been that cold has been sitting in your body long enough, and then you'll start to get a fever, and you go through the whole cycle. And but wind can also be to the point where your body is shaking, you're getting quivers. It can go to the extent where someone with Parkinson's disease, that's another manifestation of wind. They may not have gotten it from a cold, but something in the body was trapped, and now it's becoming cold and you're getting quivers. And obviously back pain and sciatica, that's the most common. Usually that's due to some sort of fall or injury, which would be chi stagnation. When I say chi stagnation, that stagnation just means that the chi is not moving properly through that area. Blood stagnation would be that the blood is not moving properly through that area. And we got a lot of this in school. And typically, the patient would lay face down on the massage table, and we would access the points on the back. So sometimes they would have 20, 30 needles just on their back or more. So we would access the needles, the points on the back. There's some points on the back of the leg we might access as well. And for sciatica, we would use longer needles because it's in the hip. So a 1-inch needle just won't work. We have needles up to about 3 to 5 inches long. And we would utilize that for sciatica, and utilize the urinary bladder and the gallbladder points, because those run in the back and on the side of the body. Also with back pain, we would do cupping, and we would do what we call fire cupping. That this traditional method, that's how I was trained, where you take the glass cup and you take and I'll show you after this, you take cotton ball in a scissors and you put alcohol in it and you light it with fire and you put it in the cup to suck out the air, and then you put that cup on the back, that person's back. Now, if there's a lot of pain, say like to touch, that's meaning that the chi and the blood are really stagnated. And we would use a lancet. I think I said it earlier, we would use a lancet to prick the skin to release some of that blood. And we will put the cup on it. And then what you would see is you would see all of that dark red blood come up in the cup. And once that treatment is over, we'll just wipe it off. And then the person they would feel like 10 times better, because all it was is that blood wasn't moving. You need to move old blood so the fresh blood can come in. Now, last but not least, herbology. There are well over 300 Chinese herbs. Unfortunately, some of those have been banned in the US. So and their herbs have, there are multiple herbs that do the same thing, so it hasn't been too detrimental. Now, if we start getting more herbs banned and they're all doing the same thing, that's where we might have a problem. But the picture that you're seeing, that's the herb in its original dry form when it's dried. And typically what you would do, if you prescribe dry herbs like this, you would have the patient boil the herbs, and they can either put it in their food if they're eating a soup. Typically, we would say eating a soup form, and they can put it, they can cook it like that, or they can boil it down to a tea form and drink it. That's the more traditional way. Now we use powdered herbs, where you would still, the manufacturers will still boil the herbs down, but they spray a potato starch on it so that it's more granulated and easier to use. And I have an example of that for you. So, like I said earlier, you wouldn't use herbs. The acupuncture is a way to open the channel in the body so that the body can better receive the herbs to promote healing. So acupuncture and herbs work hand in hand. You can use them separately, but it's better to work hand in hand to treat disease. I was reading in the Acupuncture Journal, and the acupuncturist was visiting a stage 4 cancer patient, and she wasn't eating. She didn't want to go to hospice. She wanted to go home and die. The doctor gave her 3 months to live. The acupuncturist came in, the family asked for the acupuncturist. The patient was getting morphine drips like once a day. She was under 24-hour care. So he just did acupuncture because she really couldn't even eat or drink. She had a feeding tube. And I think after a few weeks, he was able to get, with just acupuncture, he was able to get her to kind of wake up out of that pain. Her pain level was on a, on a scale of 1 to 10, it was a 10. By the time he was finished with her, it did seem like she ended up dying, but she lived an extra 9 months. Her pain level was down to a 4, and she could get up and walk around. She can go to the bathroom. She could drink and eat a little bit of food. So, and that was just with acupuncture. So if she had herbs, we're not sure at a stage 4 if her cancer would have been cured, because that is terminal, but she would have definitely lived a little bit better. And the last slide, and I found this quote and I like it. It says, learning Chinese medicine is like going from simple drawings to fine paintings. The whole is always present. The yin and the yang can only be refined, never abandoned. So it's always there. It's just, you can get to it, you can access it, and you can just refine it and tweak it, but you'll never abandon it. Okay, I hope you did enjoy the presentation. And if you have any questions, we can definitely answer those now if we have time.
Thank you so much, Kimberly. I actually just learned like a tremendous amount of knowledge that I had no idea anything about. Thank you so much for that. And again, I guess anyone that is actually on our Facebook Live, we are actually in a Zoom meeting right now. If you guys would like to join us for a Q&A session.
All right, well, while we're waiting, if we don't have any questions, I can definitely show some of the things that we utilize. So I'll show you some needles. I have my needles and I have cupping. And okay, so like I was saying, these are our needles. This is what they look like. They come in pre-packaged like this, and I'll just open this one for you. This is about a 1 inch. So it comes with a guide tube, a guide tube, and just this little stopper to help it to not slide while it's in the tube. So when we're utilizing this to put it in a patient, I'll just use this as an example, like it's my patient, we would put the needle there. We would take the guide, that little stopper out, and we would prick it just like that and move the tube and stick the needle in. It doesn't have to go in far. Doesn't have to go in that deep for everything. You can just stick it in like right there and it would stay. So that's how it would be inserted, and we can insert it perpendicular at different angles, depending on where it is in the body, because you have to remember certain parts of the body are really thin. There's not a lot of muscle tissue or fat. So like, especially on the back and the chest, you wouldn't stick this very far. You might stick at an angle like that, or stick it perpendicular. It's going to be like that, but you wouldn't stick it too far, because we have to keep in mind that we have veins going through the body, so we don't want to damage anything. Okay, so that's just one needle. We do have needles, like I said, are 3 to 5 inches long, and those primarily go in the buttocks for sciatica, any type of low back, very low back pain, and sciatica. This is another set of needles. I'm not going to open this one. This one is, these are very small needles. These maybe 1/2 inch. These go, this side can be used for the face, or like I said, on those points right there, where the skin is really thin, we can use it there, or in the ear. And this comes with one, this is like a pack of 10. So it has one guide tube, and you would just use all of these needles for that particular treatment. Here we have, this is a glass cup. We have, this is a medium, and this is a small. All right, the large is slightly bigger than that. And this, any type of scissors, I mean, I have these are like scissors to cut bandages. So you can take it like that. You will have the alcohol in it. You would light it with the fire, stick it in, stick it out, and then put that cup on the area of the body. You wouldn't, cupping is usually used on the back. You wouldn't put it on the face, the abdomen. You wouldn't put it any, primarily it's on the back and maybe the butt, where they're kind of meaty areas that you're not going to really have any suction over any type of veins or arteries. As far as moxibustion, I mentioned that earlier, which is the herb that we burn. This is one that I've had a while. This is just, you will put it in this sniffer to put the flame out. But the moxibustion roll, it's called a roll, looks like this. Okay, this is traditionally what it looks like. And you can see those are all the herbs just packed in here. And you would light it and you would move it over the area you need. So you might move it over certain points. You can peck it like that. Or you can, we have little cones that we make out of this, and you can put the cone on that particular point. But you have to stay there while you're doing the moxibustion, and then you have to move it off of the area so the patient doesn't get burned. And we have herbs. So I mentioned earlier, herbs are nowadays we use powdered form. And I don't know, I'll just pour it out here so you can see. But if you look, you can see the granules. And one thing I didn't mention about the herbs is, let me just see. I think I didn't mention it. Okay. The herbal formulas consist of at least 12 herbs. Sometimes it can go up to 16. And you have a king or a chief herb. There are 4 levels: the king or chief herb, the vassal herb, which is like a deputy. You have the assistant, and then you have the worker or the delivery. So the chief herb is the main herb that is going to work towards the disease in that organ. You have the deputy, which is there to kind of assist and bring out other properties of the chief herb. You have the assistant, which kind of helps those 2 herbs. They just kind of help string them along. And then you have the delivery herb, which actually sends it to the direct organ. Because what happens is usually the chief herb is really heavy. It has a heavy energetic property. It could be a heavy herb in itself. It might be a root. It could be as soft as a feather or a petal, and as heavy as a root. You can look at the picture of the herbs and you can see that they can be nuts or anything like that. And then you look at the energetic level. So you would have the delivery herb, which has enough energy to lift that heavy herb and carry it and take it to that particular organ on an energetic level, so that the treatment can start healing the body. So this is what powdered herbs, this is typically what you would get at an acupuncturist office if they're distributing herbs, okay? And the container varies. Herbs have different scents and tastes. Some are sweet and not overly sweet, not even sweet like honey. It's just a light sweetness. Some are very bitter. So this depends on what's going on with the body, depending on what type of herb you get. And these are called tea pills. Tea pills are these herbs rolled in honey with a coating. And these are these are easier. If you don't like the taste of this, you can take these. These are more in patent formulas, so they may or may not be available, depending on what your diagnosis is. There are a lot, but sometimes this is a custom herbal formula. This is what's going to be best for you. And I have one more thing. These are, I mentioned essential oils before as a form of alternative medicine that you don't need a license to distribute, or pretty much anyone can do it because it's a practice. So there are different companies that make herbs. You have doTERRA, this is the one I usually use. And you have I usually get some from Whole Foods. So these are the herbs that you can combine together to help heal your body. I use a lot of essential oils for cold, like kids are getting sick. If I go out and I feel like something's in my throat, like I feel like I might get sick, I will come home and take On Guard. This is a good one from doTERRA. Oregano oil, wild orange, lemon, and peppermint. I usually take those 4, and within a day or so, I'm fine. So, there are plenty of modalities for you to utilize to pretty much help heal your body and bring you back into balance. You just have to be aware of what they are and be willing to use them. So sorry if I went over again.
No, that was amazing. Thank you again for showing us all of those. I really liked all of the different examples and everything. So I am actually just going to be ending our presentation. Thank you again so much, Kimberly, for all of the information. I don't see any more questions on our Facebook Live. If we are going to continue on this session for a Q&A on Zoom, the Zoom link is actually at the bottom in the comment section of our Facebook video, if you guys would like to join us for a Q&A session. If not, assalamu alaikum, everyone. For all of the individuals that are still on Zoom, I'm just going to say to just stay on here just for a little bit, and then we'll start our Q&A with us.
The live has ended.
Good.
So if anybody wants to ask any questions, I know we have one in the comments, but yeah, Farzana, go for it. I'm gonna
yeah.
mute myself.
Yeah, so the question that we do have in our chat comments right now, so the individual said that I guess many women have experienced disruptions to menstrual cycle after the COVID-19 vaccine. Have you witnessed this issue being remedied with acupuncture?
I asked my acupuncturist, and basically she told me they don't treat COVID patients while they're diagnosed with COVID. Most of the patients they're treating come in afterwards with all the other symptoms from COVID. So it's feasible to say that you would treat a menstrual problem due to COVID.
But I